name is Kathleen Maravillas. Today I'm going to demonstrate on how to perform a neurovascular assessment. So with this performance, we're going to have a series of simple tasks and assess the patient. So first, we're going to introduce ourselves to the patient, verify the name and date of birth, and provide privacy to the patient. Of course, we're going to have to perform hand hygiene and provide privacy. So now we're going to explain to the patient the procedure, letting them know that we are going to ask the patient to perform simple tasks for a neurovascular assessment. So first, we are going to test her primary sensory responses to superficial touch and pain. So now I'm going to use this straw. You're going to tell me if this is sharp or dull. Close your eyes.
Dull. Sharp.
Okay, on the other side.
Dull. Sharp.
Okay, very good. Okay, so negative findings on that. And then next, we are going to evaluate her perception of position sense, and with movement of the greater hands, or the greater toes or the fingers on each side. So in this case, we're just going to do the fingers. Okay, I need you to close your eyes and do your hands like this in the front. And you're going to tell me if I'm doing it up or down.
Up. Down. Up. Up. Down.
Okay, very good. Okay, so next we're going to assess her ability to identify object. So I'm going to give her an object, and close your eyes. I'm going to give you an object, and you can tell me which object you're feeling.
It's a pen.
Okay, very good. Okay, so next we're going to assess her the 2-point discrimination. So I'm going to touch her arms with this scalpel, and then you're going to tell me if it's a 2-point or a 1-point. Okay? Close your eyes.
2. 2. 1. 2. 1.
Okay, very good. Okay, so now negative findings on that one. So next we're going to assess her ability to identify a letter or a number that we're going to draw on her palm. So I need you to give me your hand and close your eyes and let me know what I am drawing.
X.
Okay, very good. Okay, negative findings on that one. So next we're going to assess her ability to identify body parts when touched. So I'm going to touch part of your bodies and let me know what am I touching. Which part of the body I'm touching, okay? Close your eyes. Okay.
Head. Chin. Shoulder. Forearm.
Okay, very good. Okay, so now we are going to assess her superficial and deep tendon reflexes with on her bicep or patellar. So we're gonna look for her bicep tendon, and then we're gonna tap on the thumb and see the reflex with my reflex hammer. Okay, very good. Okay, now we're gonna do the same on the other side. Okay, good. Okay, now. Okay. All right, so negative findings on that one. So now we're going to test her plantar reflex by we're going to check for a Babinski sign. So by doing that, we're going to do it on her feet and see if there's no fanning. Okay, the other side. Okay, and then She did good on that one. So now we're gonna test her ankle clonus. Okay, very good. Okay, so now we're gonna test her cerebellar function and proprioception. So what we're gonna do is I'm gonna let you bring your arms up, and then with your index finger, I need you to touch your nose alternately with your arms. Okay, close your eyes and do it. One more time. Close your eyes. Okay. Other side. Okay, very good. Now you can bring your arms down. So next we're going to test, evaluate her coordination and fine motor skills. So I need you to put your arms like this and then go like this. Then do it on your lap and then alternately with fast motion. Okay, so good. And then now you can do pedaling on your feet alternately. Okay, very good. So her fine motors and her coordination is in good rapid rhythm. So and then next we're going to evaluate her balance using the Romberg test. So I need you to stand up. Put your arms on the side. Now I'm going to put my arms in the inferior and the anterior position to check if there's any swaying while she's closing her eyes. Okay, very good. So the last part of this demonstration is we're going to let the patient, we're going to observe the patient's gait for posture and rhythm by letting the patient go walk towards and back. Just walk normally. Okay, that concludes our demonstration. We're going to help the patient back in her bed, and we're going to provide call light, make sure that it is within reach, and then document all findings of the neurovascular assessment. And that concludes our demonstration. Thank you very much.